Family planning is a vital and essential public health service. It helps couples determine the size of their family, as well as the timing and spacing of their children. This Family Planning Month, we take a look at the state of family planning in the Philippines and how it benefits not just the parents, but also the children. Joining us via Zoom is Dr. Eileen Grace Tancinco. She's a family planning specialist who practices obstetrics and gynecology. She's also part of the Philippine Society for Responsible Parenthood. Good morning, Dr. Tancinco. Thank you for joining us. Doc, what is the general overview of family planning in the Philippines?
Well, right now we are actually working on it again because of what happened during the pandemic. And hospitals are already opening and with the services of the family planning available for our countrymen.
Right. When you say because of what happened in the pandemic, what exactly are we talking about?
Because of the lockdowns, the people or the patients cannot go to your LGUs or to your hospitals to avail of the family planning methods. Now that we are easily opening up, so these methods are already available in the hospitals and in the LGU. So they can actually go to the health centers, to the hospitals to get their family planning methods as compared to the lockdown.
Well, that's definitely positive news. How significant, Doc, would you say are responsible parenthood and family planning in improving the health and well-being of the Filipino family, especially in the new normal? Some surveys show that the pandemic has actually lowered our reproduction figures. Is this correct?
Actually, it does not, because there's a lot of they stay at home, so they have they're not able to get their family planning method. So most of the patients get pregnant. And what's good with a family planning method is they allow the patients or allow the couples to get the ability to know the number of children they want, because family planning is an essential health need of our patients. With this, when they do practice family planning, they would be able to determine and achieve the desired number and the timing of children according to their plan or to their aspirations.
Right. Let's unpack that a little bit more. The benefits of family planning. It's not just health. It's the health of your family's finances. It's your actual health of the mothers. Let's talk a little bit more about how the proper planning will benefit the whole family.
So for the mother, it would enable her to get back to her health after her delivery, and she would be able to have more time for her family as well as for her own personal development as a woman. And it gives more opportunity for love and care for her attention to her husband and her children. So for the children, when they have healthy mothers, of course, they would be healthy as well. And of course, for the fathers, it would lighten the burden and the responsibility in supporting his family, and he would be able to provide for his children the basic needs: food, shelter, education, as well for a better future. And it gives him time for his family and his own personal advancement also. So it's not just the personal aspirations, but it would benefit the whole family also.
There you go. Doc, can we cite some surprising yet common reasons that discourage or prevent participation in family planning? Is there a certain stigma associated to going to your LGU and asking for help when it comes to family planning?
So most patients have a lot of misconceptions about family planning methods, how it would affect their health, it would cause cancer. But actually, there's a lot of benefits, non-contraceptive benefits of these methods, not just them being protected from getting pregnant, but they can be protected from getting sexually transmitted infections, as well as certain cancers like endometrial cancer and ovarian cancer.
Okay, really quickly, Doc, what are some of the common methods that we should be looking at or that can be considered in terms of family planning?
So we have our short-acting methods like your pills, and then we have your injectables, and then we have your long-acting reversible contraceptives, your contraceptive implant, as well as your IUDs, and then our permanent methods like your tubal ligation and our vasectomy. So these are all available in your LGUs as well as your hospitals.
There you go. Many different methods to achieve the same result. Thank you so much. That was our family planning specialist, Dr. Eileen Grace Tancinco.